The idea that someone would refuse to eat something from the floor, deeming it dirty or unsafe, but would put cocaine up their nose is an interesting example of cognitive dissonance and hypocrisy. On the surface, both behaviors involve the introduction of substances into the body, yet they are perceived very differently due to a number of psychological, cultural, and social factors. This contradiction can be broken down as follows. When someone refuses to eat food that has fallen on the floor, the decision is often framed as a matter of hygiene. The food is deemed dirty or contaminated, even if it has only been exposed to a relatively minor risk, such as dust or bacteria. This rejection aligns with social norms. We are taught from a young age that food on the ground is unfit for consumption, and to eat it might invite ridicule or judgment from others. On the other hand, snorting cocaine, a behavior that entails far greater risks, often escapes this same moral lens. Yet, in some social contexts, this act is glamorized or normalized, viewed as an indulgence rather than a transgression. Here lies the hypocrisy. The same individual who wouldn't risk the negligible harm of eating slightly dirty food might think little of engaging in a behavior that directly imperils their health. The double standard is rooted in how society conditions us to perceive risk and morality. Eating from the floor is seen as a base act, a violation of cultural norms surrounding cleanliness and propriety. In contrast, drug use, especially in certain circles, is portrayed as edgy or sophisticated. This dichotomy illustrates how societal narratives can distort our priorities, placing undue weight on superficial cleanliness while trivializing dangers. This type of selective logic permeates many areas of life. Consider the person who berates someone for smoking cigarettes but drinks excessively, or the individual who preaches environmentalism yet drives a gas-guzzling SUV. These inconsistencies arise because humans are adept at creating moral hierarchies that justify their own behaviors while judging others. The double standard, in essence, reflects a universal tendency to prioritize appearance over substance. Ultimately, the hypocrisy of these behaviors challenges us to examine our priorities and biases. Why do we fear minor risks like a speck of dirt but dismiss profound dangers? Why are some transgressions harshly judged while others are rationalized or even celebrated? Recognizing these inconsistencies is the first step toward more authentic and consistent decision-making.